EDTA chelation. Gary Gordon founded this ACAM, and they chelated with this magnesium EDTA by vein, which the magnesium EDTA goes in, and first thing it does, it pulls out all the lead and cadmium, and then the second thing it does is, see, as we get older, we get a higher amount of intercellular ionic calcium, and the magnesium EDTA takes the calcium out of the body and puts magnesium where the calcium was, and that seems to be a benefit. It does not cause osteoporosis. You might say, hey, you take calcium out of the body. Well, the thing is that, if you talk to the really smart bone pathologists, they will tell you that osteoporosis is not a calcium deficiency disease. It is a bone matrix deficiency disease. That is, the protein part of the bone doesn't form. If you do sections of bone of osteoporotic women, 100% of the bone is calcified. There's no uncalcified bone. It's just that there's not enough bone matrix. And so that's one of the reasons why all this forcing of calcium and worrying about calcium has not solved the osteoporotic person problem. The thing is, what you want to do is to build up the bone matrix, and one of the symptoms of scurvy, by the way, is osteoporosis. And so you give them the vitamin C, and you give them zinc, manganese, chromium, selenium, the cod liver oil for A and D, the D is important there. And all these things help to build up the bone matrix. And I realized years ago that patients that had been on this program for years and years and years didn't have osteoporosis. And so this brings up another thing, is people with food and chemical sensitivities are making adrenaline and or cortisone, see, to block their allergies. And I find that the garden variety neurotic that you see is an adrenaline maker. They can be bitchy and off and on and so forth and so on. They're hyperactive, they're the workaholics, they can be millionaires and then have heart attacks. So the cortisone type person is heavier set, collects fluids, has a higher incidence of cancer, and also a higher incidence of osteoporosis. One of my theories is that endogenously produced cortisone causes osteoporosis also. So this is one of the other things we're trying to do, is to get away from food and chemical sensitivities to get rid of osteoporosis.